Hello viewers, welcome to the Bachelor course of Population Studies. Today we will discuss National Family Health Surveys. The National Family Health Survey is a large-scale, multi-round survey conducted in a representative sample of households throughout India. 3 rounds of the survey have been conducted since the first survey in 1992-93. This survey provides state and national information for India on fertility, infant and child mortality, the practice of family planning, maternal and child health, reproductive health, nutrition, anemia, utilization and quality of health and family planning services. Each successive round of NFHS has had 2 specific goals. A. To provide essential data on health and family welfare needed by the Ministry of Health and Family Welfare and other agencies for policy and program purposes. And B. To provide information on important emerging health and family welfare issues. The Ministry of Health and Family Welfare, Government of India, designated the International Institute for Population Sciences IIPS, Mumbai as a nodal agency responsible for providing coordination and technical guidance for the survey. The National Family Health Survey was initiated in India in the early 1990s, with the first NFHS conducted in 1992-93. Since then, India has successfully completed NFHS-2 in 1998-99 and NFHS-3 in 2005-06. Let's discuss National Family Health Survey 1, 1992-93. First National Family Health Survey was a nationally representative survey of ever married women aged 13 to 49. The NFHS covered the population of 24 states and the National Capital Territory of Delhi to provide demographic and health data for interstate comparisons. In NFHS-1, a total of 88,562 households were covered, and the interviewers collected information from 89,777 ever married women aged 13 to 49, 23,455 in urban areas and 66,322 in rural areas. The fieldwork was conducted in 3 phases between April 1992 and September 1993. The households covered in the survey included 5,492 residents. As shown in graph number 1, at the time of NFHS-1, total fertility rate TFR was 3.4 children per woman. The NFHS rural total fertility rate 3.7 was 36% higher than the urban TFR of 2.7 children per woman. Women with at least a high school education have a total fertility rate of 2.2 children per woman, whereas illiterate women have a TFR of 4.0, which was 87% higher. Muslim women had a total fertility rate of 4.4, which were 1.1 children higher than the total fertility rate for Hindu women. The total fertility rate was below 3 children per woman for Christian, Sikhs and women from other religions, primarily Buddhist and Jains. Scheduled caste women had a higher TFR of 3.9, scheduled tribe women of 3.6 and non-SC/ST women of 3.3. As shown in graph number 2, childbearing in India was concentrated in the age group 15 to 29, which contributed more than 3/4 of total fertility. 17% of total fertility was accounted for by births to women in the age group 15 to 19. The fertility level declines sharply beyond age 30 and childbearing was negligible for women in their 40s. As shown in graph number 3, more than 60% of children in the age group 12 to 23 months had received all the required vaccinations in Tamil Nadu, Maharashtra, Himachal Pradesh and Punjab. During the 2 weeks preceding the survey, 7% of children under ages 4 had symptoms of acute respiratory infection, cough accompanied by fast breathing. 20% were sick with a fever and 10% had diarrhea. Knowledge and use of oral rehydration ORS packets for the treatment of diarrhea were not widespread. Overall, 57% of mothers were not familiar with ORS and 74% had never used it. As shown in graph number 4, undernutrition among young children was relatively low in Kerala. 29% were underweight and 27% were stunted. Undernutrition was particularly high in Bihar and Uttar Pradesh. So, the data from NFHS-1 revealed that there were considerable variations across states and communities in all of the socio-economic, demographic and health parameters. Kerala, Goa, Tamil Nadu and Himachal Pradesh have achieved relatively good results on the demographic and health front, and a large number of states including Maharashtra, Punjab, Haryana, Karnataka, West Bengal and Andhra Pradesh were clearly on their way to achieving the national demographic and health goals. However, Uttar Pradesh, Bihar, Rajasthan, Madhya Pradesh and Orissa, which together constitute 43% of the population of country, were lagging far behind the development process. And these states have a major influence on the averages for the country as a whole. National Family Health Survey 2, NFHS-2 1998-99. The second National Family Health Survey, NFHS-2, conducted in 1998-99, provides information on fertility, mortality, family planning and important aspects of nutrition, health and healthcare. The International Institute for Population Sciences (IIPS) coordinated the survey, which collected information from a national representative sample of more than 90,000 ever married women in the age group 15 to 49. The NFHS-2 sample covers 99% of India's population living in all the 26 states. This report was based on the survey data for 25 of the 26 states. However, since data collection in Tripura was delayed due to local problems in the state, IIPS also coordinated the first National Family Health Survey NFHS-1 in 1992-93. In addition, the NFHS-2 questionnaire covered a number of new or expanded topics with important policy implications such as reproductive health, women's autonomy, domestic violence, women's nutrition, anemia and salt iodization. The NFHS-2 survey was carried out in 2 phases. 10 states were surveyed in the first phase, which began in November 1998, and the remaining states except Tripura were surveyed in the second phase, which began in March 1999. The field staff collected information from 91,196 households and interviewed 89,199 eligible women in these households. In addition, the survey collected information on 32,393 children born in the 3 years preceding the survey. National Family Health Survey 3 NFHS-3 2005-6. NFHS-3 collected information from a nationally representative sample of 1,09,041 households, 1,24,385 women aged 15 to 49 and 74,369 men aged 15 to 54. The NFHS-3 sample covers 99% of India's population living in all the 29 states. NFHS-3 also collected information on population and health indicators for slum and non-slum populations in 8 cities, namely Chennai, Delhi, Hyderabad, Indore, Kolkata, Meerut, Mumbai and Nagpur. Fieldwork for NFHS-3 was conducted in 2 phases from November 2005 to August 2006. 35% of population was under age 15 and only 5% was age 65 and older. 14% heads of households were women. Over 2/3, 69% of the population lived in rural areas. Based on the religion of the household head, 82% of households were Hindu, 13% were Muslim, 3% were Christian, 2% Sikh and 1% were Buddhist, Neo-Buddhist. All other religions together account for less than 1% of the households. 19% of the household heads belong to the scheduled castes, 8% to the scheduled tribes and 40% to other backward classes, OBC. About 1/3 does not belong to any of these 3 groups. 27% of households had below poverty line cards. Currently married women and men with 2 children who want no more children by number of sons. A strong preference for sons is evident from the responses of women with different number of sons and daughters. For every number of children, the percentage of women who want to stop childbearing is lowest if the woman does not have any sons. For example, as shown in figure number 1, among women with 2 living children, 90% want to stop childbearing if both their living children are sons, and 88% want to stop childbearing if they have 1 son and 1 daughter. The proportion who do not want any more children decreases to 62% for women with 2 daughters and no sons. Knowledge of pills, condoms and IUDs among youth. Figure number 2 shows the extent of knowledge of specific modern spacing methods for men and women aged 15 to 19 and 20 to 24. Women are most likely to know about pills and least likely to know about IUDs. Men are also least likely to know about IUDs, but their knowledge of condoms is very high, more than 90%. Women are more likely than men to know about pills and IUDs, but less likely to know about condoms. Trends in contraceptive use. As shown in figure number 3, over the past 13 years, there has been a steady increase in CPR from 41% in NFHS-1 to 48% in NFHS-2 and further to 56% in NFHS-3. Trends in vaccination coverage. As shown in figure number 4, there is an increase in the proportion of children fully immunized and a decline in the proportion of children who did not receive any vaccinations between NFHS-1 and NFHS-3. The coverage of BCG, 3 doses of polio and measles, has also improved considerably since NFHS-1. Nevertheless, gains in full vaccination coverage and in the coverage of each individual vaccine were greater between NFHS-1 and NFHS-2 than between NFHS-2 and NFHS-3. The very limited progress in coverage of full immunization between NFHS-2 and NFHS-3 is mainly due to the coverage of third dose of DPT, which has remained almost constant between NFHS-2 and NFHS-3, 55%. The trends in vaccination coverage between NFHS-2 and NFHS-3 in urban and rural areas show that there is greater improvement in the coverage of full immunization as well as in most vaccines in rural areas than in urban areas. In fact, there is nearly 2 percentage point decline in full immunization coverage in urban areas between NFHS-2 and NFHS-3. Further, coverage for each of 3 doses of DPT also declined in urban areas between the two surveys. The proportion of children receiving 3 doses of DPT declined from 73% in NFHS-2 to 69% in NFHS-3. These data indicate that India still lags far behind the goal of universal immunization coverage for children. Interstate variation in contraceptive use. The fertility chapter has already shown a wide variation in total fertility rates across the states. As shown in figure number 5, the contraceptive prevalence rate, one of the important proximate determinants of fertility, also varies substantially across the states, from a low of 24% in Meghalaya to a high of 73% in Himachal Pradesh. Other states in which at least 2/3 of women use contraception are West Bengal 71%, Kerala 69%, Andhra Pradesh 68% and Delhi, Maharashtra and Gujarat 67% each. National Family Health Survey 4 NFHS-4 2014-15. National Family Health Survey 4 is an ongoing process. NFHS-4 sample size is expected to be approximately 5,68,200. This is expected to yield a total sample of 6,25,014 women and 93,065 men eligible for the interview. In these households, information on 2,65,653 children below age 5 will be collected in the survey. NFHS-4 has 2 specific objectives: A. To provide essential data on health and family welfare needed by the Ministry of Health and Family Welfare and other agencies for policy and program purposes, and B. To provide information on important emerging health and family welfare issues. Therefore, NFHS-4 will provide estimates of the levels of fertility, infant and child mortality, and other family welfare and health indicators by background characteristics at the national and state levels, and measure trends in family welfare and health indicators over time at national and state levels. Provide information on several other emerging issues including perinatal mortality, adolescent reproductive health, high risk sexual behavior, safe injections, tuberculosis and malaria, family welfare and health conditions among slum dwellers. In addition to the 29 states, NFHS-4 will cover all 6 union territories for the first time. Conclusion: these surveys provide state and national information for India on fertility, infant and child mortality, the practice of family planning, maternal and child health, reproductive health, nutrition, anemia, utilization and quality of health and family planning services. These surveys indicate that there is a continued improvement in some fields of health, fertility and immunization. But still, a lot has left to be done for better living. Immunization coverage has improved substantially since NFHS-1, when only 36% of children were fully vaccinated and 30% had not been vaccinated at all. There is very little change, however, in the full immunization coverage between NFHS-2 42% and NFHS-3 44%. NFHS-3 results suggest some improvements in housing condition and standards of living of households since NFHS-2 7 years earlier. 68% of households in India now have electricity at the time of NFHS-3. Most households, 88%, have access to an improved source of drinking water, with greater access in the urban areas. NFHS-4 is mainly committed to collect data about health and family welfare. It will also provide information about the other emerging issues related to family welfare. With this, we come to the end of today's lecture. Thank you very much.